Today I have John and Dr. Pyle Coley. They're going to here to discuss the importance to speaking to a doctor about symptoms and will highlight a treatment option for symptomatic oHCM. Good morning to both of you.
Morning.
Good morning. It's great to be here.
Thank you. Dr. Coley, what is symptomatic oHCM and how does it impact people?
Symptomatic obstructive hypertrophic cardiomyopathy is called the great masquerader because oftentimes patients and physicians alike can actually miss it. In fact, there are some estimates that tell us that 80% of cases are undiagnosed or underdiagnosed. So it's really important to be plugged into your body and your symptoms. And that's why John and I are here today working with Bristol Myers Squibb to really raise awareness of what symptomatic obstructive hypertrophic cardiomyopathy is and how you can sort of think about the disease. So I want us to think about our heart like a muscle pump, right? It's a pump that pumps blood to our body all day long. And if you have obstructive hypertrophic cardiomyopathy, you have a genetic problem with how the pump is formed. And the pump is a little bit stiff. So it doesn't feel like a water balloon. It feels like a lead balloon. So it doesn't fill up with blood as well as it should. And the hallway that the blood uses to leave the heart to get to the rest of the body, in obstructive hypertrophic cardiomyopathy, that hallway is thickened and narrowed. So the blood isn't able to get out to the rest of the body. So you can imagine if you're exercising, you need more blood to get out. If it doesn't get to your brain, you feel lightheaded, dizzy, or feel like you're going to faint. If it doesn't get to your heart and lungs, you feel short of breath or feel chest pressure, chest tightness. And it's a condition that can wax and wane. So some days are good, some days are bad. And oftentimes patients blow it off and say, oh, they're just getting older, or maybe they're out of shape. Or in some cases, they actually dial back their activity in order to keep up with the problems that the disease causes.
Now, John, could you please share the symptoms you experienced and how you came to be diagnosed with oHCM?
You bet, James. So, I've always been an active person. I really value just the art of being active every day. I played college tennis back in the day and just enjoy a very active lifestyle. So interesting, both my two brothers and myself were all misdiagnosed with heart murmurs when we were in our 20s. All three of us would later be diagnosed with oHCM by the time we hit our 50s and 60s. My symptoms started when I was in my mid 50s. I started feeling dizzy when I was on a walk, and this dizziness got worse over time. I also got short of breath when I started a walk or even a bike ride. It became difficult to do really anything without just having to stop and catch my breath. I even switched from tennis to pickleball, thinking that would be an easier sport. While I enjoy the sport now, back when I was first diagnosed, it didn't work out so well for me because I was constantly, losing my breath. So these symptoms continue to interfere with the things that I really valued most, and that's my ability to stay active. Finally, I did see another cardiologist, and about 3 years ago, I was diagnosed with oHCM.
Now, doctor, tell us about how symptomatic oHCM is treated.
It's really important to treat patients because, as you heard from John, it can really affect the quality of their life. So, there are surgical options where you can go and actually cut out a part of that hallway to make more room for the blood to get out. We usually don't start there. We start with the medications. And so beta blockers are commonly used. These are medicines that slow down the heart rate, so they allow more time for the blood to get out of the heart. And then there's also a medication called Camzyos or mavacamten that decreases the force with which the heart squeezes. Because one of the problems in HCM is also that the heart squeezes a bit too hard, causing it to kind of collapse on itself and suck itself closed. And same for that hallway. So if you decrease the force of contraction, you actually kind of rest the walls of the hallway a little bit and allow the blood to get out more efficiently. And that's a medication that I've seen a lot of patients have a very dramatic improvement on because they're able to get back to the things that they enjoy so much in their life, like in John's case, pickleball. But if you're reducing the force of contraction of the heart, it's really important to make sure you're checking on the heart regularly to make sure it's not getting too weak. So any patient taking Camzyos or mavacamten has to have echocardiograms on a regular basis in order to check on the heart muscle.
Now, John, how were you treated for your condition and what kind of impact did your treatment have on your symptoms?
Yeah, so I started out, like Dr. Coley said, with a beta blocker, like so many others, but my symptoms persisted. And then my cardiology team told me about a medication called Camzyos to treat my symptomatic oHCM. I took that medication for about 3 months, and suddenly my symptoms started to, over time, get better. I was delighted that I could play pickleball again. Even my friends noticed a difference in me and the way I was playing. So my symptoms today, such as shortness of breath and feeling faint, that sort of stuff, are much better. And I'm even competing in pickleball tournaments again, as an amateur, of course, after getting permission from my doctor. So, and this is so important to me because I thought my days of being active were over, and this has really given me some hope. Others may experience different symptoms and different results, but if people out there are experiencing symptoms like mine, I encourage them to go see their doctor. Proper diagnosis and Camzyos has made a difference for me and my symptomatic oHCM.
Now, doctor, where should people go for more information on oHCM?
I would encourage everybody to get as much information as they can because knowledge is power. And camzyos.com is a wealth of resources about what obstructive hypertrophic cardiomyopathy is, how it's diagnosed, as well as some of the treatment options. So be sure to read about it and make sure that you stay informed. And certainly if you have any symptoms or have any questions, your doctor is also an excellent resource.
John, Dr. Coley, thank you so much for joining us on Morning Blend. Dr. Coley was talking about hallways to the heart, John. The first thing I thought about in my mind, if you remember the movie Fantastic Voyage, that was kind of entered my mind a little bit there too. So both
There you go.
Yeah. Thank you for joining us on Morning Blend.
Thank you
Thank
for
you for
having me.
having us.